I'm Dr. Anjali Huda Sangwan, an American board certified obesity, metabolic medicine, and clinical nutrition consultant.
Is GRA 100% curable?
Now with the new medications, yes. If you treat it, the key is to diagnose it early and then manage it aggressively early, especially with the advent of biologics now. They should have a normal lifestyle if it's treated right and if it's treated appropriately and if it's diagnosed early. There should be we do not see deforming disease anymore because of the advent of these medications, which is why early diagnosis is important, very important, and especially in children, because they have a tremendous capacity to basically absorb all this and basically bounce back, because their immune system is so powerful that they can overcome it if they have the benefits of the right drug at the right time. So management and aggressive management is important. Get them into remission and then they're good.
Yes, I hope I answered your question. How to avoid rheumatism in aged people?
So rheumatism is a generalized term. It's no longer rheumatism is basically joint aches and pains, which are, and you mentioned older people, so most commonly age appropriate changes are seen as we age and celebrate birthdays. It comes with a package that your joints will wear out, just like driving a car, and so therefore you have to be aware of those things, and things such as regular exercise, such as diet, is very important as well. If you cut if you supplement yourself with omegas, etc., that's helpful as well. And then, of course, some form of exercise is very important. It's very important because if you don't use it, you lose it, especially as you age. So that's very important. And this is generally termed as rheumatism.
Okay, so we have I see lupus is not very common in India.
Right.
But there are times that people show up with nerve fatigue.
Right.
Like sounding like a chronic fatigue syndrome, fibromyalgia. Is it a real diagnosis?
Yeah. So one of the most common things that you see is oftentimes is chronic fatigue. So chronic fatigue is by itself it's a diagnosis by itself, chronic fatigue syndrome, and that is diagnosed only when you root other things out. So in a young lady, it's very important to root other things out, and if they come and keep complaining of chronic fatigue, such as hypothyroidism, that needs to be ruled out. That's one of the most common causes of chronic fatigue. Similarly, in our field, if you have chronic fatigue, you want to make sure that this is not related to any autoimmune disorder, such as lupus, in which chronic fatigue is very common. However, chronic fatigue by itself does not raise the suspicion for lupus. You have to have lupus as a separate, distinct entity in which there are other symptoms and signs, including one of them is chronic fatigue. So if patients have skin rashes and they have hair loss and they have sores in their mouth and they have joint pain and swelling and they have terrible fatigue and they are intolerant to the sun, that's when lupus needs to be entertained. By itself, chronic fatigue has several other causes. Even fibromyalgia is one of the other causes of chronic fatigue, which is seen often in the younger population, especially women.
Right. So, I do have a lot of patients with fatigue, and it's just I know sometimes it's lifestyle and sometimes it can be something
right.
different.
So, you want to do your vitamin B levels, B12 levels, you want to do your thyroid, you want to do your hepatitis serology. Sometimes hepatitis A, B, or C, either one can cause significant fatigue. You want to do a vitamin D 25-OH level, which again, if you are significantly depleted with vitamin D, it causes something called secondary hyperparathyroidism, and that causes fatigue. So stuff like that. I mean, they need a full-fledged workup, and things need to be ruled out. So everything after you've ruled everything out, and they continue to have fatigue, then it's either fibromyalgia or it's chronic fatigue syndrome.
A lot of the Indian population has vitamin D literally below 5.
Right. So that's where your parathyroid start getting dysfunctional, and you have to replete it with high dose therapy for at least 6 months, oftentimes to a year. We find that it's one of the most common deficiencies in the United States as well.
Yeah. Someone's asking about sprain and pain, but we're not talking orthopedics here. So it's like somebody had a sprain in ankle.
While playing basketball, and I got.
And got recovered from it, but suddenly 2 weeks back doing standing on stairs got my pain back again.
Right. So basically, what it is it's very hard to get rid of sprains completely if you're sprained significantly enough. Sprains are basically localized inflammations because of some kind of a trauma along the tendons and the ligaments that run and get attached to a certain point. And so the attachment itself doesn't cause it, whether they get attached. That's not where we heard. Basically, the area along the sheath, the fascia, that gets inflamed, and it's local inflammation. And so basically, you did something that caused it to have significant amount of strain, and then the inflammation is local, and that's called a sprain. Now, what happened most probably is that you redid it again, and it has triggered that. So the ice or heat, rest, and then some form of exercise, mobility, and then of course a trial of anti-inflammatory medications such as naproxen or ibuprofen, that should do it.
Yeah, okay, I hope you got your is there any form of exercise that you can recommend? I'm suffering from severe joint pain.
Well, where are the joint pain? That's very important. I mean,
Yeah,
is it in your back? Is it in your hands? Is it in your shoulders?
Yeah, Karishma, can you be specific?
And how old are you?
Yeah, depends on your age and what
Right.
joint is involved. So if you could answer that. Hi doc, does quitting gluten and dairy help in RA, rheumatoid arthritis?
It does. It does significantly benefit with basically alleviating the symptoms. So yes, if you do that. There is more information now. There was a recent research, we call it discovery, actually done by an Indian. It was done by an Indian in America, in I think Penn State. They found that the proteins out of the cow's milk can cause rheumatoid arthritis. They're linked to it.
Wow, guys, this is important information.
Yeah.
Very, very good. That's why I stop everyone's dairy and they go crazy on me.
This is hot research. I'm talking about 6 months ago. This was published 6 months ago.
Yeah.
This is just the latest cutting edge research, and this person is actually from India, actually from Kashmir.
Wow,
Yeah.
from your place.
My hometown, yeah.
Right. Okay, so I have a lower back pain while shoulder exercise in the gym, and it's 2 years. I have pain in lower back also. Should I stop the gym or not?
So it's a generic question. The most important thing I would like to know is how old are you, and basically are you in shape? I mean, are you basically an avid person who goes to the gym, and are you significantly in shape, or are you a person who wants to lose weight and do that? So that basically changes the whole thing. So there is not a set answer I can give you and tell you, hey, stop. If you're significantly in shape, you should not stop it. You should continue it, but you should go down to a lesser intensity. Sometimes I have athletes coming and telling me that they hurt, like you said, and the reason is simple. It's called over-exercising or overdoing things, and if you do it, you become obsessed with it, you will continue to hurt. And so on the other spectrum, I have patients who are really out of shape and they're deconditioned, and they get too aggressive with it, and then they hurt the following day. So in that particular instance, you should know, you should have a structured regimen. You should know what you're doing. Warm-ups are very important, and then making sure that there's no other pathology, there's nothing else going on, such as a frozen shoulder or a sprained rotator cuff. Those things need to be ruled out before you actually can go to the gym and lift, or you can run or whatever you want to do. And if you have arthritis in your knees, which is basically osteoarthritis, then you should avoid doing certain types of exercises such as jogging or fast running or sprinting. So it depends upon what spectrum you're at.
Wow. Alright, next question is coming. Rheumatoid arthritis, does it raise the problem of having other diseases also?
So because it's an autoimmune condition, it generally it dominates. So if you have one autoimmune condition and you simply have a risk of having another autoimmune condition. It doesn't mean that you'll end up having it. You just simply have a higher risk of having another autoimmune condition, such as Hashimoto's thyroiditis. It's commonly seen. But again, it doesn't mean that you'll end up getting it. You just have a higher risk of getting it than the average person who doesn't have an underlying autoimmune disorder.
So the guy from the exercising lab, and he's 24, and I think he didn't tell what his shape or BMI, but I'm assuming he must be.
Right. So you're probably young and
Yeah, young and
you're probably more aggressive. He needs to just
calm down.
Needs to calm down and have a very structured regimen. Know exactly what you're doing. If you're doing bench presses, you should know how to execute the motion, how to lift properly. Form is very, very important. If you're doing squats, for example, I see in the gym the most common thing that I see is not poor form. They don't know what they're doing. They'll squat and they'll hurt. If you don't do it right, you'll definitely hurt. And also, you have a risk of doing something such as herniating your disc if you're not doing it right, because you're going to lift something on your back, and if your form is not right, then you're certainly going to have more problems than benefits. Certainly. And then another thing that I commonly see in the gym is deadlifts. Everybody wants to be still on, but there is a form to it. Deadlifts are very, very, the form is very important when doing deadlifts. You have to keep your back out, your butt out, and go back and forth and make sure that your weights that you lift are appropriate to your strength.
It took me so long to master the deadlift.
Don't overdo things. You're going to pay for it.
Yeah. So next question is 8 kilometers. I walk 8 kilometers a day and I have a joint pain for next 2 to 3 hours, but the next day I'm normal.
Yeah. So I won't worry about it.
Yes.
I will cut it down from, why do you do 8? Why not 5?
Yeah. Why do you have to walk 8 kilometers? Just walk 5. Somebody asked for protein requirement if the uric acid is high, and how can it be controlled?
Okay, so you have to understand where the uric acid is coming from. So you are either, the reason you have, high levels of uric acid expose you or kind of make you prone to a condition called gout. Everybody who has high uric acid does not end up having gout. So the reason you are having an elevation in your uric acid level is either you are an overproducer or you are an under-secretor, meaning you either produce more, genetically you produce more, or there is a problem with your kidneys, you don't flush it out, you don't pee it out. And so that's very important to define what the problem is. Most commonly, 80% of the times, you are an under-excretor. You do not excrete, you end up keeping it in your body because of the filtration system of the kidney is slow. And that raises the uric acid levels. So if it reaches a certain point, it makes you prone to a condition called gout. Even with elevated uric acid levels, you don't end up always having gout. And in that particular case, the condition is known as asymptomatic hyperuricemia. And there is no treatment for it unless it is really, really high. Now, you need to understand, 2 points above the norm is not a cause for concern. But if you're 5 points above the norm, then of course that needs to be delved into as to why you're keeping high uric acid. Are you an overproducer or are you an under-excretor? And so, with generally speaking, with high levels of uric acid, it's a level-dependent thing. If you have high levels, then obviously you're prone to having gout. And so, certain things will promote uric acid in your diets. If you have a certain diet that you adhere to, it keeps you from, it starts generating high uric acid levels, such as, when I talk about diets, such as beef protein, pork, beef, any form of red meat ultimately leads to the degradation of the product, which ultimately forms something called purines. They are metabolized as purines, and the ultimate result of the purines is the end product is uric acid. So you should cut down on those kinds of meat, which is basically red meats. There are certain types of seafood as well, such as prawns, shrimp, shellfish, and that promote high uric acid levels as well. And there is liquors, and certain types of liquors are also.
Please give that information.
Yes, especially beer, because beer has something called the guanine in it, which is basically an amino acid, which basically ultimately leads to a faster promotion of uric acid than the other relatively other forms of liquor, mainly because of something called guanine in it. And so you should, in patients who have gout, definitely should not take it, because it's a very fast causal relationship. The day they have that is the day they experience a flare, because it goes into your system and it stirs up the uric acid in your body, and that triggers a gout flare.
Yeah, I have a lot of issues with high uric acid, and sometimes I also feel fructose,
Yes,
excess
absolutely.
fructose.
High, yes, it's proven now. High fructose corn syrup also promotes uric acid. So the one thing that helps you is cherry juice. That's scientifically documented that cherry juice will bring down your uric acid levels.
Cherry juice. Very important, because I really have young kids who want to go on keto diet, and they have a high uric acid, and I'm like, and there's overuse of xanoic in this.
Absolutely.
Overuse. Like you have an 8 of the uric acid and
People start patients, yes.
Yeah.
You should not do that. That's not a good thing to do, to be on a medication just to
Yeah.
keep your uric acid levels low. The body does not, it doesn't suffer from it unless they are very, very high.
Right. Then I lost my hair. We're not doing hair loss right now, and so we've touched osteoarthritis, rheumatoid arthritis, and aches and pains. Any particular? I can't see Facebook today because the camera is really far. I just cannot even read it. So I'm sorry, the Facebook people. I'll probably sit and answer your questions later. I'll ask Dr. Khan to help me. ACL surgery precaution, post-surgery. Is there something that you would answer?
Sure. ACL is one of the most important ligaments in the knee, anterior collateral ligament. Oftentimes, the most common cause is trauma, and skiing is considered to be one of the sports that causes ACL damage. And of course, I don't know what the case is here, but I'm assuming that some form of trauma caused you to have a ruptured ACL. So post-surgery, basically rehab, go slow. You gotta keep it quiet. Don't do any aggressive movements. You've got to cut down on, if you're doing some form of exercise such as jogging or running. You shouldn't do that till it's completely healed, because it's very important for that tendon to heal, because it will help you in the long run. I'm assuming you're young. You don't want it to be symptomatic on a daily basis for the rest of your life. So you want to make sure that it's well rested, and what we call it is rehab. You go through the rehab process. You do physical therapy, structured physical therapy. They teach you exercises. They're called quadriceps strengthening exercises, which are basically flexion extension exercises. You do it, and then of course you take some anti-inflammatories if it's still swollen, and apply some local heat or ice if it gets symptomatic at times. But the key is to have a good rehab, which is generally anywhere from 6 to 12 weeks.
So, I think Manvi, you got your answer. Can smoking cause arthritis?
Smoking does not directly cause arthritis, but smoking causes worsening of arthritis. If you already have conditions such as rheumatoid arthritis and you continue to smoke, it will be simply hard to treat it. And if you quit smoking, you have one less risk factor for it to get aggressive on you. So, but by itself, if you're a smoker, it does not cause you to have arthritis per se. But certainly, if you have arthritis and you're a smoker, you have a bad outcome. It takes time to
even lupus, right?
Right. Smoking is basically, it causes inflammation in your body. It causes what is known as endothelial inflammation, meaning when you smoke and it goes inside, immediately it starts making inflammatory cells, and these cells then circulate within the vessel walls, which is known as the endothelium. And on a regular basis, you do it, depending upon how much you smoke. This becomes a constant process, and you have then you're inflamed everywhere. That's why smokers end up having heart attacks, because their arteries in the heart, the coronaries, are inflamed, and they continue to get inflamed over a period of time, and then they start clogging, and then they end up having a heart attack. So same thing with the immune system. They have inflammatory properties. Smoking induces inflammatory properties in cells, and that causes you to have worsening of rheumatoid arthritis.
Alright, so smoking is bad. Someone's asking smoking causes cancer. Yes, it does. Alright, so one question is, my husband's 42 years old, 97 kilos, not into any physical fitness. He's having upper back pain and no sleep because of that. What do you recommend?
Yeah, so maybe anti-inflammatory diet along with anti-inflammatories by mouth, along with a structured exercise program that should do it. Significant. I cannot tell you this. I cannot stress the importance of just walking. Even if you walk, you'll shed weight, and that helps a big time. You don't have to take anything long term for pain, such as exposing yourself to narcotics and pain medications, which have addictive potential in the end. But if you can have a healthy lifestyle and dietary changes, that goes a long way. So I would certainly keep that in mind. Walking and jogging, or just low impact exercises where you shed some weight, and then take the help of some over-the-counter anti-inflammatories such as Tylenol or ibuprofen or Aleve such as naproxen. That should help you.
Okay. What is the main reason of inflammation and cramps in the legs? Very generic.
Inflammation and cramps. So cramps, again, the cramps could be either a localized problem, meaning you could have a problem within the calf area alone, and that causes, such as stiffness in the muscle, which causes ultimately a cramp, or it could be a larger process, such as deficiency of potassium, which is known as hypokalemia. So if somebody is taking a diuretic on a regular basis, they deplete potassium, or it's a water pill. If they're taking a water pill, which is known as a diuretic, they deplete potassium and magnesium, and that is important in maintaining homeostasis in the muscles. And so once you lose that, you end up cramping. And if that's not the case, then of course it's local, which would basically mean that you would benefit from some form of a muscle relaxer. In the first case, you would have to go back and replete your potassium or magnesium. So cramping depends upon the treatment of cramps, depends upon the cause, really.
Mm-hmm.
And so if you're taking a diuretic and it's causing you to cramp, then you need to either replete that or stop the diuretic. And if not, then you need to have some kind of a muscle relaxer, which you can apply locally at night if it's causing you problems before at night. And you can do it before you go to sleep, or you could use a muscle relaxer orally as a pill.
Very good. I think we've taken enough questions. Is there anything else that's coming up? And Facebook people will be answering your questions. Just leave your questions there and we'll take the question later.